Let's look at the assessment of rotation from a full body through isolated segmental thoracic rotation. So full body rotation, let's turn as best you can towards me as far as you can. You want to make sure there's no cheating, but we should be able to see the opposite shoulder, which you notice we can't see. Let's go full body rotation the other way. We would expect to see the opposite shoulder. And you want to make sure that the whole body's rotating. But that tells us there's a deficit in rotation. The question is, where's it coming from? Because that's the whole body rotating. Let's try to figure it out. Let's get rid of from the waist down. Come on over here. Come around to this side. Kneel, face this way. So now we're not using the lower legs at all. Cross your arms in the front. Rotate towards me. And again, we should be able to see this side. Now rotate the other way. You should be able to see the opposite shoulder. Still restricted. And we can also see there's an imbalance between the left and right as well. Turn towards me. So now we're not using the feet, knees, and ankles. It's just from here up. Let's get it segmented to just thoracic spine now. Face that way on the table. Sit back. Now here we would just, and then this elbow goes in there. The other hand goes behind your head. And then rotate up. But look at that rotation. And down, elbow down, and rotate up. That's phenomenal amount of upper thoracic rotation. And let's switch sides. Usually that's where the major restriction is. And then it cascades down. But look at, go ahead, rotate up. And look at that. That's a little restricted to the other side, but that's excellent. Go back down and rotate up. Look at the degree of rotation. That's almost getting to 90 degrees. And if I give her a little assistance, she can get there. So I know it's a stability issue. Come on back. So those tests tell us her loss of rotation, which happens to be where her primary complaint is in the thoracic spine, isn't primarily here. It's coming from down here. So what we're going to do is we're going to treat the pelvis and balance the pelvis, and then we're going to recheck her rotation. Okay, so let's treat you. So what have we done? We did some myofascial release over the hip flexors. The left was tighter than the right. We adjusted the sacroiliac joint. We adjusted the thoracic spine in what's called extension. We didn't work on the rib heads this time. Sometimes we do, sometimes we don't. Let's see what happens. As best you can, turn towards me. Cool, huh? You can see the other shoulder and rotate the other way. Little restricted, but much better than before, all right? So come on back. Let's do the kneeling one. Come on over here. You're gonna kneel, face me this way. Yeah. No. This kneeling one. Yeah. Do it. Now rotate towards me. Look at that rotation. So all of this tightness in here was actually creating her mid-back pain. Rotate the other way. Look at that. Phenomenal. All right. However, when she's standing, she doesn't have quite that much rotation. That tells us there's still a little bit going on down through here. All right. So maybe we have to look at glute medius. Maybe we have to look at the lateral chain. But that's the process. And of course, the other one where you're facing that way should still be really excellent. Butt goes back. This elbow goes over here. Your other hand goes here. And then rotate up. Look at that. Fabulous. That's the way it's supposed to be. That's normal thoracic rotation. Most people can't get anywhere close to that. Switch. Let's see if the other side is going good. But she started off that way. Her problem with her upper back wasn't in her upper back. It was in her pelvis. Came in with pain here, lack of mobility here. We had to fix this to fix that. Rotate up and see what happens. Dynamite, okay? Normal on both sides. So that's the thoughtful approach to restoring thoracic spine, mobility, and function. The problem's not always where the pain is. Thanks for your time. We appreciate it. All right, thanks for tuning in. It's a great day to talk to Courtney Campbell, who is on her way to the Pan Am Games. That's great. We're real proud of you. Now, you're going to be competing in track and field. What's your event again?
High jump.
High jumper. And you're going to be competing coming up this weekend, correct?
Yes, I believe Saturday. Really happy I came here. I would recommend everyone to come here. They helped me so much, and I'm just really excited to see what I can do.
Well, we're excited for you too. Bring home some hardware. How's that sound? All right. God bless you. Take care now.